Welcome to this webinar. We all know that coronavirus is one of the emerging infectious diseases that we need to deal with. There are quite a number of other things that have happened in the past. When we think about Ebola, which has been a major problem, issues that has to do with infections across Nigeria and across the world, we know that we have challenges. But the challenges we have has been challenges that we all know about, that we all have an idea about, challenges that scientists, experts have experience about, and they've been dealing with it. When HIV/AIDS came into Nigeria, for example, or let me say even globally, there wasn't an understanding. You know, when you talk about gay men in San Francisco, key issues in other parts of the world, and by the time HIV came into Nigeria, when we had the first case around 1986-87, we knew we had a problem. And efforts were being made at that time to address the issues. Researchers were working, and social influencers were also working, NGOs were working to address the issue, because HIV affects or affected virtually all of us. So one key thing that we need to realize at this time is the fact that coronavirus, COVID-19, as it's well known, is a different ballgame. It's like bringing research, bringing laboratory into public limelight. Scientists are known not to talk to the public unless they have a finding. But what we have now is like laboratories have been brought into public limelight. Laboratories have been brought into the village square. And when scientists talk, they talk about Eureka. Yes, I found it. A scientist may be in the laboratory, a researcher may be in the laboratory for 30 years. If he has not found that thing, that solution, if he has not published into peer-reviewed journals, he won't say anything. But what do we have with COVID-19? Now we have social media. We have people who can manufacture stories, news within the household. We have people who can sit down and compound something. And this is comparable to when HIV came. We had people who came up that they had a cure and so on and so forth. But let's dwell on that. We have three people with us today, three people who have, are exemplary in what they've done, what they are doing, and what they have continued to do even with coronavirus. We have Mrs. Moji Makanjuola. If you have been following NTA News, or if you have been following NTA, Nigerian Television Authority, you realize that Moji Makanjuola is synonymous with health reporting. Moji Makanjuola is synonymous with health promotion, synonymous with health education. And Mrs. Moji Makanjuola is also a fellow, a Knight Fellow of the Center for Disease Control in the United States. And looking at the experiences that she has had over the years, we feel that she's in a better position, in a very good stead to lead us, or to be one of those who will lead us today. And the topic she's going to talk about, I'm going to introduce the other gentlemen as the program goes on. This is not to pander to any known system of, okay, ladies first and so on and so forth. But she deserves to lead the way. So our topic is the reign of pseudo-trado medicine in public health response to COVID-19. And I want us to bear at the back of our mind that pseudo and trado medicine has been taken to a higher level, where countries are even claiming that they have a cure, where misinformation has taken the lead. And I'll leave the rest for Mrs. Makanjuola to provide us with the answers. Mrs. Makanjuola is a member of the Federal Republic, MFR, Executive Director of International Society of Media in Public Health. Mrs. Makanjuola, you are welcome. You have the floor.
Thank you very much. Can you hear me? Can you hear me?
Yes, we can hear you. Go on, ma'am.
Okay, a very good afternoon, and thank you,
Hello.
Akin, for that very long introduction of me. I do hope that this afternoon will be a call to service, which has always brought all of us together, and to address the issue of fake news as it affects COVID-19. Okay, thank you. This is me. Good afternoon, everyone. Can we have the slides, please?
Sorry, I want to do this.
I'm waiting for the slides.
What are you showing me? I can't remove the dress. Please.
Yeah. I'm still waiting for the slides.
Yeah, the slide is projected.
I can't see it.
Hello, can people see the slides?
Can people see the slides?
Yes,
we can.
Yes, we can.
I can't see it.
We can see it.
I don't know what is happening. I can only see myself. I can't see my slides. Okay.
I was seeing it before.
Okay, I can see. Can we go back?
Okay.
Okay. Yeah. Okay. Let's first of all, let's again. Thank you. Can you go back, please? Yeah.
Okay.
Thank you.
Oops. Sorry.
Go back to the very first slide. Thank you.
Yeah.
Okay. Thank you. My conversation, I call it conversation because I'm sure that is going to be very participatory, is for us first to familiarize ourselves with the back, what fake news is all about. Then we are going to be speaking to trado and pseudo drugs, so much ado about nothing or plenty to do about something. Then of course we are going to speak to the other pandemic, fake news. Then reporting trends or truth, and of course, finally, investigative journalism at the panacea. I do hope that you can all hear me. Hello?
Yes.
Yes, everyone can hear you, ma.
All right, can I have the next slide, please? Of course, we're all very familiar with several meanings of fake news, misinformation, disinformation. It accompanies pandemics, and I think Akinlabi Jimoh opening remarks alluded to the fact that misinformation and disinformation, accompanies what we witnessed in the 80s with HIV and AIDS, what we witnessed in the, 2 years back about Ebola, and of course, other things, other pandemics and other epidemics as well. This in turn undermines medical advice. We know that, let's take, for example, the issue of Ebola. With Ebola, it was for you to take as much salt as you can, have your bath with salt, and all kinds of things, running around, and people generally endangering their health because of the fake and unauthenticated news that was coming out about prevention and treatment. So fake news is usually manufactured with no respect for accuracy, and usually people would just buy into it and endanger their lives and people around them. It usually would cause a lot of panic, and it will increase vulnerabilities. So that's fake news. So now that we have familiarized ourselves with this, let's now go to the next slide. Next slide, please. Hello. Hello. Next slide. I'm just showing here some of the things that people usually would do with fake news in an epidemic. Usually, alternative medicine practitioners these days are leveraging on the COVID-19 to sell unproven products. Unproven because it's not scientifically proven. It has not gone through the process of clinical trials, and some particularly very popular one is the use of chloroquine. Some people say they use it, it helps. There had been a lot of talk about the gingers of this world and the other alternative medicine. But a lot of this, they lack scientifically proven evidence to support creative claims. Majorly marketing practice, and they use the media to market it. You will recall that on the 27th of March, if you read the Punch newspaper, reported that the Presidential Task Force on COVID-19 said 3 out of the numerous claims of COVID-19 herbal cure have been validated and forwarded to relevant authorities for validation. So, in spite of all this, I think the public is too much in a hurry to either prevent or treat at home, as the case may be. And this depicts that trado medicine, as much as we have them around, it's been around for as long as life has been, but must go through the process of investigation, verification, and standardization. And oftentimes, media do not understand this process. So you go to, I do not want to mention names here, but there have been people in our country that have alluded to the fact that they have found cure for a lot of things, cure for HIV, cure for this, cure for that, cure, all kinds of cures that have not been validated and has not been proven and has not gone through the process that through the process of pharmacology, which will make them useful for mankind. So here we are with COVID-19, and there has been an avalanche of all sorts of products that you can use at home, which you can use as preventive or you use as treatment. And every day, particularly on the social media, they are watched. You see them you need to, in the panic that and the anxiety that COVID-19 has created, you need the grace of God not to fall victims of a lot of these news items that are watched on social media and, of course, some traditional media as well. Next slide, please. So, the social media has been a bane for the spread of unverified information and cheap publicity. People have come, people have said all kinds of things, how they have been able to use some trado mixtures for people that have been, diagnosed with COVID-19, and within 3 days, media is awash with it. From every nook and cranny of the world, you see some even show pictures to further, convince people that whatever they are selling or marketing would work for you. Social media users are more likely to share fake news and pseudo medicine than medical information from legitimate health authorities. Before I continue, let me just take our minds back that I'm sure that what we are saying today, or what I'm alluding to, is not that traditional medicine does not work. That's not the issue. The WHO recognizes alternative medicine, and I have seen in the lab some of this trado medicine, and we know that China is very popular with this. We also know that for us in Nigeria, we have alternative medicine that has become for people suffering with sickle cell anemia. With Nitrate in Nigeria, they have been able to come up with a drug that came from herbs and is working for people living with sickle cell anemia. So I just want to say to us that trado medicine or alternative medicine, whichever way you choose to, is recognized but has been standardized in countries where they have been used as alternative care or medicines. Now, so how do we get to know this? They include series of adverts for trado and homemade remedies. I've spoken about the salt issue for Ebola. These days for COVID-19, the ginger of this world, the lemons of this world, garlic mixture, all kinds of things. Take it with honey, drink as much water as possible, stay in the sun. When you stay in the sun, you are not likely to be infected. All kinds of, rumors and news and sensational comments and even some from health experts that you'll be amazed that, look, where do I go? Orthodox or alternative medicine? Well, we would actually recommend that see a doctor, and your doctor would tell you what's best for you. So now on WhatsApp and Facebook are common conduits for the spread of these reports. The radio that I quoted here reports that fake news is getting in the way of Africa's response to COVID-19. And I think this is something that we as journalists or health correspondents, if you are there, or science correspondents, need to quickly go to the communities to find out, because we're still having people infected with the virus. So what is responsible for that? Is it that people are becoming careless, or they are resorting to using alternative medicine or trado medicine, which is not proven or is not potent to cure when you get infected with the pandemic? Next slide, please. Next slide, please. Thank you. Well, another one that is actually hitting the waves, it's essential oil. Usually they talk about eucalyptus oil. I can talk about it and say, oh, if you put eucalyptus oil and you have it on, there's the likelihood that you will not catch the virus. In fact, a lot of things have gone on, and every day, you see this. It's not as if it's ending, it is there every day. And since we still have the pandemic with us, we must be able to sieve the truth from the myth. Next slide, please. Next slide, please. we must, next slide, please. Can you hear me? Thank you. Let's now try to, I think everybody that has a smartphone or, or any of these devices are susceptible to, to get carried away with fake news. According to WebMD, young children and the elderly may be more sensitive to essential, well, talking about essential oils now, which I have spoken about. Well, I'd like to move away from that now. Can I have the next slides, please? Thank you. Now, this is what concerns us, and I think it is the kernel of our discussion today. Reporting trends or truth. Oftentimes we just go to press without verification, without, and especially if you are a regular on the desk, the editor would believe whatever you bring in, because some of our field officers have been tested. So there's a likelihood, if you are talking about traditional media, newspaper, the print, and the broadcast, if you bring in a copy about a cure, there's the likelihood that the news producer or the editor of the day might just take it in because they expect that you know better. And that's why I'm an advocate for specialized field. But you must authenticate where this is coming from. So the pro media versus the reactive media. The proactive media would find out, will do research, will reach experts. But the reactive media is just wants to hit the newsstand. He just wants to be, and he just wants to ensure that, oh, I have good news here. It will sell our paper, or it will give us more listeners or more viewers. Well, when you're reporting health, or when you're reporting a pandemic, that is not the case. The media needs to take a proactive stance against pseudo-medicine, difference from truth. You must be able to call an expert to speak to whatever your findings are. I recall, and Aki and Diran, I'm happy that you're both listening. I recall that when there was the big story on someone who said he found cure to HIV in the 80s, we didn't just run to the press. The man in question was subjected to a lot of tests, to a lot of questions. And we're able to ask questions because we are asking from the point of knowledge. If you are not knowledgeable and you are not trending on issues affecting people, there's the likelihood that you are the victim of promoting something that has not been authenticated. I'm sure the rest is history. An analysis from Thailand suggests that 75% of news reports on COVID-19 are fake. That's a very serious trend. And we must be able to use, if we are not, and we must expand our scope, not just using the Nigerian factor, but check around. For us, when we were reporting health in the 80s, was very difficult because we didn't have the devices that you have today. Please sieve out the substance from the chaff. There are even fake news about fake news. In researching for this, and when I saw this, I'm like, okay, so even there's the thieves among thieves. So we must also be careful when we are authenticating our stories. Now, how do we stop fake news? A variety of issues that I have been able to put forward here, by no means all that you need to do. But from my experience, this is what I have applied.
consider the source. Is there an author? Check out their credentials, relevant issues. If we are speaking, for example, if you want to know about the virus, you can look for experts. I remember that at the beginning of the COVID-19 and all, I had to remind my colleagues at NTA that we have a top global accepted, tested virologist in Nigeria. We know, but Professor Tomori had worked even WHO, and I recommended him as one of the resource persons that we need, to speak to. And I'm happy today that he's leading the ministerial committee on COVID-19, the Ministry of Health on COVID-19. That is a good resource. And even with him, we can also have others that we can go to find out and make sure that whatever we are to check out their credentials on relevant and use them. Now, supporting sources. We need to know who to go to next. Thank God the platform has been very, very active during this crisis. So you know where to go. You know where to get your story. You do not rely on them say. You now go to ensure that you have a supporting source. And thank God there is also, every day you listen to PTF address or speak or clarify issues. We should be at the of ensuring that that is done. Then as correspondents or journalists or media practitioners, we must read beyond what we are fed. Headlines can be outrageous in an effort to get clicks. What's the whole story? There'll be a big headline, very attractive, all attention arresters. And then you go to the body of the story. There's really nothing to, there's no education, there's no, and it's just to sell the. And with health, I think we should be more careful. Again, when we're talking about supporting, do others agree? When you're doing a story, particularly on COVID-19, not just one source. We these days we rely on the source. I'm sure, because from what I read, we rely on the source of the PTF. But are we going beyond that to see? Have you been to the hospitals? Have you been able to visit the isolation centers? Have you been able to go to the lab to even see how they culture a specimen? We see all this happen. We see it on international airwaves. Why aren't we doing that? Because these are the ways where we can put fake news to bay. So now, it's too outlandish. It might be a satire. Research the source to be sure. There are so many things that on the social media, for example, so many things. This morning, I was looking at one that was very emphatic, speaking to the use of ginger mixed with lemon and garlic, speaking to the fact that he was actually showing that mother or grandmother or thereabout, was alleged to have COVID-19. And after the use of these trado mix, 3 days after, the woman in question had gotten better. How was that woman tested? Now, how would you sit in your home and think that what she has or what she had was COVID-19? Did anybody come to test? These are the areas where, us as media practitioners would be more alert and let people know. And we can only do this if we know the process, if we know how you can arrive at being said to be affected or infected with COVID-19. Now, sometimes we are also our own fake news bearer. Consider if your own beliefs or concerns would affect your judgment. If you are reporting health or reporting science, then it has to be science. It will not be because Mr. A or Mrs. B has said this, it has become news. It must not align with your religious beliefs. It must be things that you know would be good for humanity. And oftentimes we are too, our beliefs or concerns guide what we write and what we say. For COVID-19, that's not the way to go. Yeah, again, I have emphasized that you must check your biases. You must also ask experts, the experts. They are so important. Yes, we must communicate, but we do not have the answers because we are not experts. I don't pretend to be a doctor, I'm a journalist. And that's why it's important that we must consult a fact-checking site. We must also consult official sources like the World Health Organization, like the CDC, like the Federal Ministry of Health, like the NCDC and the PTF and other sources that are known, other platforms that are known. Don't go to places where you cannot quote. You must be able to quote and cite where your quotation is coming from. Now, you must be convinced yourself that I have been objective in this report. Have I stated the fact? Have I mingled it with myths? Am I trending? Am I speaking the truth? These, I'm sure, are the way to go. Now, before I round up, what then is the solution? Where do we go from here? Because I believe that every opportunity is a learning curve. So, investigative journalism, the panacea. That's what I want us to take home from my presentation today. Deeply investigate and research the subject matter. The subject matter for us today is COVID-19. Be proactive, reaching out to experts, reaching out to sites, reaching out to platforms that will enrich your story. You must be open-minded about it. Your beliefs or concerns or your affiliation has nothing to do with this. You must state the fact. You must ask the right questions. I get thoroughly embarrassed these days when I listen to the kind of questions that journalists mete out to experts. It's like you don't know what you are asking. It's very pedestal, and you can only do this when you are knowledgeable about what you're doing. You must employ logical thinking. That, I think, is the strength in journalism, and we must allow this to be our watchword all the time. We must effectively communicate. A lot of times our stories are not deep enough. The stories, they're just shouting headlines. And of course, for the social media, people get away with anything. Effective communication is so important. All of this can be achieved when we have capacity building for journalists. It can be in terms of you seeking out for training, which are very, very available, particularly during this pandemic. I saw that WHO had a lot of trainings for media practitioners, but it can be personal and it can be collective. Collective in the sense that There's no exclusive story with the pandemic. You can always seek your friend. Hello? You can always seek opinions, or you can seek verification from your friends, and you have to cover the story. You have to be there. Last, can I have the next slide, please? Well, I want to thank you all and thank the Ovie Brume Group for inviting me to speak. I do hope that I have been able to speak truth to fake news. Fake news is fake news. It doesn't have any other name. And I think that President Trump has drummed this up. As health or science correspondent, it is important for us to be able to sieve good from what is bad. Fake news is bad. We shouldn't be in the league of people who are amplifying fake news. Thank you, everyone, for listening.
Thank you, Moji, for taking us through a number of areas, a number of issues. Some we've taken for granted. Some are issues that virtually affect all of us. But at times we don't take those issues seriously. And you've talked about quite a number of things. You know, there is no smoke without a fire. The believability of stories, you know, matters a lot. I was reading one article about, you know, myth busters. There are a lot of myths about COVID-19. Some will say if COVID-19, the virus cannot survive in, you know, in this part of the world because the heat is very huge. And there are quite a number of other myths that people have pushed out. There's a thinking that when myths are pushed out a lot, at the end of the day, it becomes the real thing, that people are not able to differentiate on what is the truth and what is not the truth. Thank you for your presentation. And please, if you have questions, please go into the chat section and drop your questions, so that when we get to the question and answer session, you know, we can see the question that you want to ask. Questions, contributions. We'll go quickly now to have Mr. Onifade. Mr. Onifade, can you hear me? Hello? Hello?
Hello.
Okay.
Yes. Are you hearing me?
Yes, I'm hearing you. I hope others are hearing you too. Thank you for creating time to be with us today. This is a webinar by Ovie Brume Foundation, Youth Empowerment Foundation, and Development Communications Network. The three organizations have been concerned about the way we are going. And the next presenter and myself have been discussing over the years in terms of what is wrong with us. What is wrong with us as citizens? What is wrong with us as a populace? What is wrong with us even as journalists who are part of the populace also? So Mr. Onifade was the Vice President of the World Federation of Science Journalists. That was about a decade ago. He was also the President of the African Federation of Science Journalists. Is a Knight Fellow of the Massachusetts Institute of Technology, MIT, Knight Science Journalism Fellow at MIT. And he used to be with NTA. He has also covered issues that has to do with business reporting and so on and so forth. And let me say that Mr. Onifade was perhaps the first journalist that will show the face of HIV in this country. At that time, around year 2000, when we had issues that people were saying that they had a cure for HIV. And he went to Otukpo in Benue State. At that time, we had a prevalence rate of about 23% in Otukpo, the highest at that time. And he went there, he showed on the national television fresh graves of people living with HIV/AIDS who had passed on, you know, at that time. And Mr. Onifade is going to have one-on-one discussion with all of us. There's not going to be a projection, but what we have is a conversation that will more or less go into the depth of the issues we are talking about. Mr. Onifade, you have the floor, sir.
Well, thank you very much, Aki. I must say, so many people in the room that we haven't met, but Aki and I, we have been collaborators all this while. This is full disclosure, and it's always looked the way it's looking now. So there aren't too many people alive now who doesn't know Aki with his gray hair. and also I'm looking at the picture of Professor Fayoyin. Professor Fayoyin taught me at a time when I was learning to be a journalist. I'm not saying he's an old man. He's still, you know, it doesn't look that old. And of course, the previous speaker, Moji Makanjuola, who is a sister of mine, it's always good to see you and to see that you're still kicking, even though, I mean, you are not looking as old as you should look. You're a multiple grandmother, still looking like a girl. So why am I saying all these things? Because too many people in the room that I haven't met before, and we have to put all these things on the table. We are old war horses on this desk. And when old people meet, what do? They tell stories. In any case, but because I've only 15 minutes, I'll try not to tell too many stories. So going straight to the point, we can only say, okay, what has just happened? Because we are facing a novel situation. We are dealing with a kind of virus that the world has not seen before. So the kind of situation we are in is new to everybody. Now, being new, did it catch us napping? Because it became new just meant you could not have prepared enough for it. So, as the community, as the media community, how do we fare this time around? Now, to know whether we have done well or we didn't do well means there must be some basis for comparison. And I think for people of our own generation, what we have to compare with will be the outbreak of the HIV virus at that time. And if you ask me, straight up, to say whether we did well or we didn't do well this time around, I will say that compared to that time, we did better. We were not excellent, but at least we did better than that time. Now, what would have been responsible for that? We have become, in the media, a mirror of society. It's part of our function but it is even more so now, in the sense that the news cycle here is fed and led by the propaganda machines of public sector, private sector, and things like that. We say what they want us to say. That's why you see them hiring the best hands to be their media managers, SA medias, public relations manager, and things like that, because they need to be dictating to control what goes out in the media, and to a large extent, they did that. Now, in the period of HIV and now, comparatively, this situation better control. When HIV broke out, it was new, and there are kinds of at that time that, oh, it cannot affect black people, we are too strong for it, all those things. Fela said AIDS is American invention to decide, and so on. The desk that was created was headed by a young doctor at that time. I'm surprised that when there was this COVID-19 outbreak in that was that young man who was the doctor at that time who spoke from Kano, which is to say he is still in service. So you can imagine service the presidential task force is headed by the secretary to the federal government. And it's not so. Almost everybody that the health community, the media community, the security community, all kinds of people that you meet are all and of HIV until 50 years later. So this time around, you at least found some the right kind of information. You have addressing the media almost every day, and you know, and so on and so forth. So that being the case, you found that there were constant flow of information, of story. Now, that is good in some ways. So you find that stories improved in quantity. You had general page allocations in newspapers, and apart from the issues of COVID-19 dominating the bulletins of the broadcast media, the issue also featured in virtually all manner of programming formats, and many of them even created special programs. So the information is always there. So the media was not deficient of content. The question is, what kind of content? Now, like we said, that it is multi-sectoral, so you are having more of information having to do with testing, with the curfew, palliatives, and so on and so forth. But because of this multi-sectoral approach, we tend to have neglected the science part of the whole of these things. So the science suffered. As a result of the science of its suffering, science journalism also suffered. Now, don't forget, when this thing broke out in China, they were able to combat it and win because science was at the forefront of their response. But as far as we are concerned, science is at the back end. So in terms of the coverage too, science journalism is at the back end. I mean, for instance, you have the Presidential Task Force, PTF. I do not know about you, but I did not for one day see the Minister of Science and Technology sitting with them in that meeting for one day. And the Ministry of Science and Technology is the only ministry in the Federal Republic of Nigeria that has the word science to its name. So while you have the health component and all those things, the ministry that looks at the science research end of it was not in the room. So at the beginning, you were hearing references to NIMA, to NIPRID, at the tail end, you are hearing something about NIPRID, of all the things that NIPRID can do. NIPRID is Nigerian Pharmaceutical Research
Institute.
And all they could do was to be doing hand sanitizers that people can do in their kitchen. So you can't really see them getting involved in serious science. So because you don't really get us doing serious science, you're just doing cut and paste, whatever it is that other people have done, we take it, and NCDC is running with that. That has been our kind of response. And because science, much of science was not going into how we were doing these things, you find that the coverage also didn't feature too many participation of science journalists. The people who have been covering all these things are also the people who are just generalists, people who are maybe covering the villa for their news organization, or covering Abuja for their news organization, or they are just producers of one program or the other, one show or the other for their organization. So when these people sit and they have the opportunity to meet with this NCDC Minister of Health, they too, they ask generalist kind of questions. And that is why you see that the news, we found a kind of situation where the conventional media was actually trailing the social media, because the social media, like Moji said, is the headquarters of gossip, of innuendo, of falsehood, of hoaxes, all kinds of such things. So you see that even conventional media people, in order to fill their pages, are going into social media, Twitter, WhatsApp, and things like that, to go and tap stories that end up being false or half-truths and things, and things like that. People who have been trained as science journalists, they have a means of seeing through all these things. And because we are covering this thing from a generalist approach, that is why politicians were not making the coverage easy by their utterances and and their conduct, which created distractions. For instance, the controversies generated by President Trump on the politicization of hydroxychloroquine. I mean, locally, the circumstances surrounding the hospitalization and eventual burial of the president's chief of staff who succumbed to COVID-19. So you see that majority of what we were just tracking were just this controversy or the other, this controversy or the other. And on top of all of it, as far as our local media and the continental media is concerned, is the Madagascar elixir or whatever that is. You see, that has generated a whole lot of sensation, both in the conventional and the social media. In societies where science journalism is thriving, the heat being generated by the patriotic, that's how I call it, coverage of the Madagascar stuff would have been nipped in the bud. Because science journalists will subject claims such as that to scientific verification. It's not just because people announce. When you report science, it's not what people announce, it is the process leading to the announcement. And people who report science, they are familiar with the process that leads to the announcement. When a politician who used to be a DJ and is now a president is able to just do photo opportunity and drink from a bottle and say, we have found a cure for COVID-19. Come on, some of us can always say, we've been here before. Because in Africa, during the HIV outbreak, it wasn't just Nigeria, it was Uganda, it was Kenya, it was Democratic Republic, then Zaire. People were finding cure to HIV/AIDS all the time, and the coverage was patriotic. We were covering from patriotic sense, in the sense that, look, it's just that these white people don't want us to find a cure. Ladies and gentlemen, till today, have we found a cure to AIDS? So in the end, we may just find that all these things that we're talking about World Health Organization, the Western media, the Europeans, and so on and so forth, they don't want us to find cure. It's just that the way that the Madagascar issue went, it is not the way that science functions. Don't forget, Madagascar cannot be lacking in science. Madagascar will have scientists, and the Madagascar scientists will know how to do science. The process leading to that stuff, was it subjected to the Madagascar scientific process? Those are questions that ought to have been asked. But let's say that generally, the media did well in terms of how they responded to this once-in-a-lifetime media. The only thing is, science journalism didn't do well. I need to repeat that. Journalism as a whole responded better this time to this pandemic, where science journalism did not do well. And because science journalism did not do well, it affected the way that journalism would have been able to help society in such a way that we do not cover this thing from the angle of fear, the angle of falsehood, the angle of sensation, but the angle of responsibility. But that's not to say that, well, they didn't do better than at least they did during the HIV/AIDS. It's just that we could have done well. I mean, we could have done better. And if we continue like this and we are not involving, we are not developing our science journalism capabilities, another pandemic may come and we'll still be caught flat-footed. But generally speaking, we will say that the media, that at least they committed a whole lot this time around, not just professionally, but business-wise. Unfortunately, we even do understand that some of them may go under now because of the way that this pandemic has affected their business. So these are some of the price that the industry has had to pay. And don't also forget that even we as journalists are affected. We in the media too are affected. The family of the owner of DAR Communications, the DEVCOMS, I think about 8 or 9 of them, had to go to isolation center, and then they came back with the controversy that followed that. And the issue of NTA also had to be taken to isolation center because he too got infected. There's a science journalist in Sokoto called Abdallah El Kurebe. He too had to be taken to isolation center. So why am I saying all this? We were also part and parcel of what just happened, and I'm just hoping that, you know, this time around, when the next pandemic comes, because these things will always come. If you read a book that I'm sure Akinlabi Jimoh too must have read, called the Coming Plague, written in 1999 by a lady called Laurie Garrett, you will know that plagues will keep coming. It may not come in this form next time, but there will always be a coming plague. We just need to care. My time is up. Thank you very much.
Thank you so much, Diran, for your presentation. Thank you for going down the memory lane. And there are quite a number of questions we have already. Some of them I've tried to answer succinctly, but you did mention something about a book by Laurie Garrett. I don't know if you can see, this is the book, The Coming Plague. This was written way back. And there's also another book called Betrayal of Trust, The Collapse of Global Public Health, which is also relevant to our situation. It's like having a collapse of our public health system. But the main thing is all these issues lies with us in terms of what do we do. For those of us who are not journalists, who are more or less researchers, who are experts in other areas, perhaps computer scientists, perhaps sociologists, and so on and so forth, we cannot do without leaning towards ourselves. And we have someone with us, a professor of journalism, someone who has been around for so long. I do remember that those days, when he was working, when family planning was initially introduced, you know, in the country, we had Dr. Adebayo of Fayoyin at that time working with this family health services. Is a JHU project at that time when family planning was introduced in the, I think it was in the 80s or something. You remember that song by Onyeka Onwenu, Wait For Me, and King Sunny Ade. He was part of the team at that time. And then he moved to UNICEF, Nigeria, working with journalists. And his last part of service was in South Africa as a coordinator of issues that had to do with health promotion, communication for development, community mobilization, issues that relate to virtually all of us, issues that at the end of the day, more or less shape what society is all about. And Dr. Fayoyin, Professor Fayoyin, sorry for that slip of tongue. Professor Fayoyin is presently with Caleb University here in Nigeria, in Lagos State. And we thank you for joining us. And Professor Fayoyin is going to dwell on a number of issues. He has had a number of write-ups that has to do with community mobilization, health promotion, health education, communication for development, and so on and so forth. I know that you have an article that we discussed recently, that there's a vaccine, more that's where I will summarize it. There's a vaccine against coronavirus. That vaccine is something that is in the hands of every one of us. And I won't reveal what that vaccine is, but it's in everybody's hand. But we are taking it for granted. It's linked to behavior change, and the process of taking a behavior change takes a long process. And I don't think I would want to reveal the secret. Professor Fayoyin, thank you for joining us. The floor is open for you, sir.
Okay, thank you. I have unmuted. I think you can all hear me.
Yes.
Okay, and I am sharing my file. I hope we can all see it.
Yes.
Good. Thanks to Akin Moji. It's a long time. I know we met in Nairobi a year ago. Diran, we haven't seen in 25 years. What happened to you? I can see you've gone gray now or no hair at all. Let's talk about that later. Friends, I am excited. I'm excited to be here, to be part of this conversation. I'll make it as quick as possible. I'm also happy that at least we had two speakers before. They were looking at it in more specific terms, in terms of the issues around communication and in terms of science reporting and stuff like that. I'll step up a little bit and look at it from a general point of view to make us connect from the general to the specific. And so I'll be talking about some of the lessons that you have learned from the pandemic in terms of how it affected us. The world was at peace with itself, at least until this thing came. December 31, 2019, they said it was, that they were able to unpack the genome and what the world will be dealing with since then and today is coronavirus. This is what the picture looks like. Globally, from that time, 6.6 million people infected, 388,000 people dead, luckily 3 million recovered. Africa has gone across that milestone, the 100,000 milestone last week. The number of dead is also increasing. We said, no, it's not going to happen in Nigeria, it's not going to happen in Africa. Nigeria has already 11,300 plus dead. The impact is more than that. We're not talking about a pandemic that's challenged the ethno-linguistic and geographic identities in the Northern Hemisphere. Can you hear me? You can see it? Okay.
Yes, we can see it.
Okay, affecting the Northern Hemisphere, the Southern Hemisphere, and all the hemispheres. We thought it was only the black thing. It has affected the whites and the blacks and the colored. The gender dimensions have been broken. Major ethnic demographic groups have been broken too. Initially, it was the old people. Now it's literally speaking everybody. We thought it was going to affect only this generation. It has affected all generations. What has happened is COVID-19 has not spared any class, color, creed, or community and leveled everybody globally. We've also seen tremendous psychological impacts. While it's an epidemiological crisis, it's a psychological crisis. Studies and trends have shown that the level of worry, the level of fear, the level of concern, mental health is completely on the increase because of this pandemic. Even physical, spatial, social distancing is contributing to major challenges that individuals are facing. Signs of anxiety, panic, depression, in some cases, suicidal tendencies among families. But I know that is not while that is important, our issue is information. And so here entered infodemic. When in March, WHO announced that we were facing a global pandemic, it also said we were facing two pandemics. The pandemic of the coronavirus itself and the pandemic of infodemic. And so for the first time, we heard the word infodemic, which is linked to the massive information and misinformation on this virus. As at May 1, 2020, globally, the International Fact-Checking Organization has identified 4,200 of those global misinformation, hoaxes, falsehood, and stuff like that. And in Africa, too, at least about 250 plus. You can imagine one disease, as it were, one virus, as it were, 4,200 stories around it. And WHO noted that if it wasn't controlled, it was going to undermine the work of world. So what is the scope? We know it, so I'm not going to go into it. It was 3G, it was manufactured in China, it was warfare between China, it was, if you take disinfectant, it will stop it. If you use garlic and pepper, it will stop it. If you use many other things, it will 4,000 words, 4,000. And where did it come from? From all of us. Citizens, journalists, the public, the video bloggers, the comedians, the jesters, the entertainers, the political leaders, the religious leaders, all of us have contributed to it. Through diverse images and pictures and cartoons and videos and social media posts, the use, misuse, and abuse of data through music, through numerous materials. Friends, the list is endless. We also have the African flavor to it. Akin was talking about the paper we read. We did a short blog around it, and we conducted focus group discussions and in-depth interviews. All they said, it was a 419 disease, it was a fake disease, it was a disease of AIDS, it was a disease of those who travel abroad. It can never come to Africa. The humid temperature will not let it come to Africa. Because we have childhood immunization and BCG, it will not affect Africa. Some people even told us that they would treat coronavirus the way we treated Ebola. It affected only those in Spain, affected those in Italy. It's just an ordinary flu. It will go away. And Moji was alluding to some of all those cures that have been identified. So we then looked at some of the causes of this pandemic, this infodemic, and we identified several of them in this. We're going to look at only 7. One is pandemic awareness. Most of us did not know that pandemics are part of human life, and they have happened before. I have a list. The Hong Kong flu of 1968, the deadly influenza of 1918, which is 100 years ago, killed close to 50 million people. The Black Death of 1346, which killed close the range, 75 million to 200 million people, not to talk about Ebola, not to talk about HIV pandemic and HIV, which has killed, literally speaking, 34 million people, and we know Africa is the epicenter. So pandemics are part of life, and they were just talking about the coming pandemic. If you look at a little bit of science information and the pathology and the trajectory of diseases, this is what normally happens. Part of the study we conducted, we found out that those who knew a little bit about some of the pandemics that had taken place actually were more aware, and they did not listen to these conspiracy theories around it. So that was one. Secondly was the poor outbreak and containment communication. Yes, we know that China wasn't transparent enough at the beginning. Yes, we know that there were certain problems with the information on how it happened, but the WHO is clear. 2005 guidelines on disease outbreak and containment, trust, transparency, openness of information critical. This didn't happen and we got ourselves into this. But we also had a situation where many of the things we were going to do, we didn't understand. Social distancing in our own age and culture, we don't understand it. The physical distancing, special distancing, the use of masks, the use of many other things that we expected to use. We found that because there was not enough effective communication around these things, it led to a lot of challenges in the crisis. I was just talking about it just now, that it's a new disease, a novel disease that we're dealing with. And the nature of novel diseases is that there are too many unknowns. And so studies have been ongoing all over the months now, actually now contradicting themselves. And if we are scientific heart very well, we sometimes know that this is the nature of science. As one finding comes and clarifies the other, it's not misinformation, it is not contradiction per se, it is the evolving nature of the crisis. Therefore, people are asking, what kind of disease confounds policymakers like this? What kind of disease spreads like this? Even when we are practicing social distancing, it's taking place. If you understood a little bit of how the infectious diseases work, some of these questions would not be asked, or at least you have a scientific lens of looking at that. So we've had to deal with this in terms of its novel nature. Other critical aspect of it is the global connectivity. We argue here that information overload is actually an understatement, because this virus has bombarded the entire world with so much information in a short period of time, and all of us believed some of the narratives that we got. And therefore, the global connectivity, where information is available by everybody at the same time, it just has compounded the situation, and therefore it creates a challenge for us in being able to get the right information. And much of the information shared, unverifiable, unvetted, unfiltered, globally available, and we are all consuming it. And it's created a major challenge for us. One of the challenges that we've also found was that there was no strong continental communications framework to communicate it. Linked to that is inadequate communications agenda, even at the national level. We know that the health mixed messaging from African heads of state, mixed messages even from government institutions and stuff like that. We did some of our key informants interviews tell us that, and we're dealing with coronavirus now. What about poverty? What about health? What about nutrition? What about water? What about girls' rights? What about all the other things? And so it confounded the coronavirus narrative. We know that some of the faith leaders haven't helped matters, and I won't go into some of our pastors that have told us they have the corrosive anointing to destroy coronavirus. But I will tell you of the story of a Cameroonian pastor, 37-year-old, who was laying hand on his congregation, even those who had been positive. Days after he was positive, days after he died. So it's no respect of religion. It's no respect of whatever I do, it's the reality that you are facing. And finally, I think it's important for us to note it, and all the previous speakers have mentioned it. Public health issues are prone to controversies. And so for those of us who have been in the field, we don't actually see it much as controversies, we see it as part of the process of understanding and education. And therefore, it's critical for us to, especially as journalists and researchers, to start to with the science of public health, to be able to understand it and decode some of the major issues that are there. It will help us. I must say this, that the whole controversy around vaccines is there, but vaccines have always been controversial since. And therefore, there are some scientists that believe in vaccines, some don't. And therefore, as journalists, a balanced perspective for us to be able to properly understand positions, interests, ideologies will be important. So what has been the consequence of all these things? I'll make it very short. One, we have had a reign of misinformation, massive information overload, misinformation on treatment, misinformation on containment strategies, misinformation on many other things, and false and misleading narrative, which has affected all of us. What is the second consequence? So much stress and panic and hysteria, especially in the month of March. Now the hysteria has at least died off. We are facing the reality, but it led to people being sick of information and fatalistic, and they just didn't want to get anything to do with the information again. Yeah, but the whole issue of legitimizing the campaign. People denied the campaign, they derogated the pandemic and thought it was non-existent. They shared innuendos and all these other things which actually heightened the stigma around it. And linked to that is non-compliance. We all saw extensive examples of non-compliance with the containment strategy. But what is particularly important for me is number 5. We are now battling with promoting health behaviors as a result of the misinformation ecosystem that we have had. As I round up, I'll raise a couple of issues. One is the effect of misinformation and disinformation. Undoubtedly, the misinformation has created a major challenge for us, and we have tried to debunk. But for those who are trying to debunk information, a little bit of caveat is important here, because if we don't do it very well from a scientific point of view, your attempt at actually debunking a misinformation reinforces it. And therefore, the misinformation effect is very strong. And we are seeing that misinformation effect affecting all social entities and the way we are relating to the response. What else have we seen? Although we have so much information, we have had so much information on the pandemic, on coronavirus, on COVID-19, people are poorly informed. The issues around its origin and treatment and its behavior and its impact not fully understood. These are some of the findings that we got. And so it also now led to that lack of conviction on the response and misinformation. Linked to that is the whole notion of low risk perception. And people then started thinking, well, okay, it's going to affect that person, it's going to affect that person, it can affect. And so all the containment strategies that we needed to have put in place is not going to affect. So we have seen a high level of low risk perception of everybody. So what are some of the recommendations that we will have? One, because other colleagues have said it, I won't bother too much about it. One is fact checking. Moji talked about it, I did not talk about it. You need to go back to fact checking. Number 2 is we need to now create a kind of counter narrative and step up the narrative that promotes effective issues and what we need to do. And number 3 is science reporting and health reporting effective that Diran talked about. And lastly is the whole issue of a vaccine against the infodemic. We argue that COVID-19 is dangerous and so the infodemic is dangerous, and that we need a new vaccine against infodemic, which will help us. We don't have to wait till 2020, 2021 to start at it. It is practicing the same simple processes that have been identified. Critical thinking, looking at the information, checking our facts and sources very well, not believing everything that we have on social media and then trying to look at it. And so I would like to conclude that there's a major challenge with us in terms of the infodemic. I think collective effort, we need to be able to address this. Thank you very much.
Thanks so much, Professor Adebayo. Now we all know what the vaccine is. And for me, practically, this is one of the, these are some of the things I've been applying, you know, when it comes to issues that has to do with Corona. At the beginning of the pandemic in Nigeria, most of the things we heard about has to do with the palliatives. Everybody wanted a piece of the action. So we heard about palliative. But the misinformation, the infodemic is another pandemic that we have, which is affecting virtually all of us. So if we can get the infodemic vaccine, which doesn't require tons of money or playing around with pathogens. I mean, it's about having the factual information and proceeding with the laid down principle that we know. Because when a pandemic comes, or when an epidemic comes, it doesn't come with the solution. The solution comes later. And why do we now jump into, oh, I have a cure, I have a cure, I have a cure? And quite a number of things have been pushed out, which our panelists have talked about. As far back as the 90s, there's this organization called International AIDS Vaccine Initiative, based in New York. They were looking for vaccine against HIV. That was as far back as 2000, 2001, or even earlier. Up till now, there's no vaccine. And these are issues that we need to really reflect on in terms of the kind of messages or information that we push out, you know, to the general public. Thank you so much for your presentation. Let me just go through, I hope we still have Mrs. Makanjuola, Mr. Onifade on the platform.
Yes, I'm here.
Yeah, there are quite a number of questions here. I pray that we are able to address all the questions. I think we have just about 30 minutes. There will be some that require yes and no, and so on and so forth. Someone said on the issue of fake news, I think government need a lot to do on this. You need to work on having the trust of the citizen. They are sometimes too slow in giving out information to the citizen, and within that gap, allow citizen to be fed with what is available. I totally agree with that. It happened with HIV/AIDS also. When AIDS cure came, it took a long time before the health ministry responded. It took some time before the Academy of Science responded. By the time they were responding, the military has said that they had 30 soldiers cured, which today is only one soldier that is alive out of the 30 soldiers. I think that is was a comment. Will you please tell me the ways to identify fake news? I think in some presentations this has been addressed. Your gut feeling matters a lot, and whatever we have read also kind of help us to address some of these things. My question is, how do we educate news consumers on identifying fake news? I think NCDC has materials on that. We need to really search for those things. I'm trying to rush through some of these things so that in case our panelists have further answers to that, they will. Confusing when two different persons in the same field say different things about particular things. How do we know which one to take with reference to different conspiracy theories? Professor Fayoyin. Or anyone, if it's not on now.
Okay, I can take that.
Okay.
You know, I believe you want me to answer the last question.
Yes.
You see, the good thing about reporting science itself is evidence-based. It's something that for you to be seen to be right, you have to be able to present the evidence, not just to yourself, to everybody, so that another person can repeat what you said you did. If you added root 1 with root 2 and you got result 3, that's you. If I add the same, I should be able to get exactly the same result. And once you said that was what you did, and I checked it out, and I got the same result, we discussed it, and you know, the way you say that you have done that in science is by publication. Okay, you publish it in scientific journal, in journals that other scientists, people like you in your discipline, have access to. and they can question it, they can query it, they can try it out if they want to. Once they agree with you, there is a scientific consensus. And the scientific consensus is the main line that is pushed. That is science. If somebody out of the entire room now says, no, I have a different opinion, that's an opinion, it's not a consensus. And where there is no consensus, that's not science. So it is not like politics where if APC says A, PDP must also say their own, even if somebody is talking bulljack. In science, there is scientific consensus in the sense that you come through a transparent process and everybody believes that you have done what is right. They try it out, is the same. So there's that consensus. So you can always judge on the sense, on the basis of consensus. But there is one thing that confuses people. They confuse authority with expertise. Experts normally will not go out and say what is wrong. Except, of course, you know, there are some people that just go low rangers and things like that, but they are not functioning from the position of consensus. The problem is where authority is involved. Like the president of Madagascar, he's not a scientist. He wasn't speaking from a scientific conference. It's just a politician wanting to be popular. And he said what he was saying, he didn't validate the science. The fact that a high up person says so does not validate the science. It is the scientific process that validates the science. Science is validated by scientific consensus, not by authority. That the president of a country, that the armed forces of Nigeria took their soldiers for somebody to treat, does not mean that person's treatment is scientific. You know, and that the president of Madagascar drinks it does not mean that it may just be safe, may not be, it may not be efficacious. I mean, we don't know until other scientists try it out. In this case, that has not been done, but a politician with authority has used the voice of authority to announce science. It doesn't go that way.
Thanks so much, Mr. Onifade. Please, there is a polling going on right now. We had many people register for the webinar, but it seems some of us were having challenges. We have a lot of omitogun on the platform right now. Please look at the poll and give us the challenges you faced while trying to join the webinar, so that this will inform, you know, our next webinar. Thanks so much. Let's quickly do that. Thank you for answering that. There are quite a number of questions that are similar to what you've just done. How do we
may I just contribute to what Diran has said?
Okay, briefly.
Yes. Yeah, I think that particularly as science and health reporters, we must understand what a process. When can a medication, you know, be out for use? What are the process involved? We must build capacity around that area. When we know, so that when somebody comes out and starts speaking to cure, we can debunk, or we'll be able to detect in good time that that particular person has not done due diligence. It is important for us, when we understand the process of how vaccines, applications are made, we would also be able ourselves, because a lot of times some of these politicians and people who just go around to say that they have bobonshe, if I may use that, a lot of them are not validated. But you can punch it if you understand the process. So I want to emphasize that as journalists, we must acquaint ourselves with the processes that will help us to be able to decipher in good time whether this is fake or whether this is real. Thank you.
Okay, thank you. There's a comment on your presentation. My comment on Moji Makanjuola's presentation is that I appreciate the ideal that has been presented, but I'm concerned that the superstitious character of our prevalently traditional society is what gets in the way, which I totally agree with. Rather than being scientific and logical, even some of our experts are operating from the trenches of myths and half-truths. The case from Oyo State Governor and CMD UCH exemplifies this. I think this also boils down to the question that was asked before, whom do you believe? If you go and report something and someone is saying something, another person is from the same field is saying another thing, which do you believe? I think one key thing is we should, nowadays there is Google. Nowadays there are websites of CDC, of WHO, and so on and so forth. The authority in healthcare delivery, authority in science research, and a lot of other leading scientific organizations. These are areas that we can quickly go into and look at what is the latest. So for those of us who are journalists, even those of us who are not in the media, the key thing is you get an information. There are myth busters. There are fact checkers online. So we don't need to be a journalist. As a citizen, there are issues that people post on WhatsApp, for example, sent as received. I hate that thing. When people send as received, what I do is I quickly go check it out. Once I fact check, I send it out. And look, go to this link yourself and see whether what you received is true or not. Someone says, should media publish a news on drugs that have not been validated by the authority in a pandemic that still lacks treatment? I don't think a news that has not been validated should publish. I don't think so. It shouldn't be. I don't know if there's any contrary opinion from the panelists or even from those of us who are listening. My name is Lawrence Afolabi. I report for Radio Nigeria. How do one report an event? Sorry. Oops. I'm trying to find the, oops. Okay, Lawrence Afolabi. How do one report an event by politicians during political crisis, inter or intra-party crisis, when politicians level all manners of lies against themselves, and you as a reporter knows all they were saying are all lies? Well, you may know, don't reveal it at that place. I think for security reasons, they are telling lies. Make sure you are not in that vicinity to tell them. You read between the lines. I mean, really, it's also about science and too. I've seen a situation where a colleague of ours who was working with one of the leading news media went for a conference by someone who had been nominated to be a minister. So in order to enhance his standing, he said he had found a cure for something. And among all the journalists that went for that conference, he was the one that reported the truth. And what he did was, what is the mechanism of action of this finding that you have? Who else has done this thing and found the same kind of response or the same results? The man was not able to respond to that. He wrote the story. He wrote the true picture of the story. The man did not get the job. He was fired, for telling the truth, for writing the truth, but he got a better job with an organization that has international news platform. So those are some of the risks that we need to take beyond just physical risks that, yeah, is it true that social media is the headquarters of gossip news? I think we need another discussion on this. I think I agree that social media is the, is the headquarters. can we say that Nigeria's response to COVID-19 pandemic is science-led or otherwise? Panelists, is Nigeria's response to COVID-19 pandemic science-led or otherwise? I think this is the crux of the matter. This is the news. This is the story.
It was politics-led. It was politics-led, not science-led.
How?
I said it in my presentation. Have you seen the Minister of Science and Technology? There is only one ministry in the federal government that has the name science attached to it. Is he a member of the PTF? So, and the Minister of Interior is there. Minister of Aviation is there. Minister of Humanitarian is there. The Minister of Health, Inspector General of Police, that all those ones are there. But Minister of Science and Technology is not even a member. So how do you say it is science-led? Science is not even near the room. I'm sorry.
So as a follow-up to that, I know we've talked about this before. You mentioned something about the fact that the PTF, daily briefing has been a photo opportunity, that I am there also, to a larger politicians and so on and so forth, being part of that. Someone is asking, why are science reporting of COVID-19 been missing? In my opinion, science reporting seems no longer taken as attractive. Investing in science journalism in Nigeria is not also seen as lucrative. And so you hardly find a handful of media showcasing that aspect of reporting COVID-19. Beyond this, agencies or stakeholders who could have made the difference at this time were not prepared in spite of Ebola experience. Can you guys comment on this?
Well, quickly, if I may jump in, I find it extremely repulsive for people to allude to the fact that science reporting is not. I don't know the correlation, but what I know is that when we report science and health, it's about life. And so whether it's, I don't know about this, for me, I'm even angered by the fact that it is linked to being lucrative or not. I think I agree with Diran that science is missing in this, and this is all about science. I recall that at the beginning, and I think on my program in March, when we had a talk show on COVID-19, what we emphasized is we were at that point, we were talking to the science of testing, the science of upgrading our laboratories so that they can meet the demand and the need of the pandemic. Whether that has been done, whether I not say because I haven't been to any of the labs, but at least we have been having results. So I think it is truly, I think it is out of tune for anybody to say that science, it depends on what you want to do. To say that one beat is more lucrative than others. No, I don't think so. I think it's about commitment, which is what we are speaking to here. And people should know that. I think you get a leverage in life when you report science and health. And I'm sure that Diran and Rachel and even the prof have proven the fact that you can reach as high as you want in whatever bit you choose to report.
Yeah, thank you.
Just one quick point is the nature of journalism training and the number of the type of stories we cover. We all know, experience has shown it, research has shown it, that media normally report more of politics, economy, and business. That has been the trend over the years. Yes, and then I mean my content analysis of Pan-African News Agency showed that, of News Agency of Nigeria showed that has been the general issue of our media practice. What has always been missing is science and health. You remember, you remember those days when we were still working in UNICEF, how to get the members of the press to actually appreciate science and health to be able to report effectively. That's one big part of it. So ongoing continuous education on that. But we also need to take it back to our journalism schools. And I can see Professor Esson on the line. Our various journalism schools need to ensure that they incorporate effective training of journalists in trainee journalists, those in the journalism schools and communication schools, on some of these elements, so that by the time they graduate, they are able to effectively report. If not, we will be talking about science and health in the missing link in most of our reportage.
Yeah. Thank you so much. There are quite a number of other questions which we may not have time to respond to. Let me just say that in 2006, there was a project initiated by the World Federation of Science Journalists. At that time, Mr. Onifade was the vice president of the World Federation. And at that time, there was the executive director who came to Nigeria during the, I think it was during census at that time, planning to spend like 3 or 4 nights in Nigeria. But by the time Diran and I worked with him, in one evening, he was able to get an idea of what to do, which was some of the things that we've been doing at Development Communication Network to address issues, that concerns people in terms of public health and science journalism. The same thing goes with Youth Empowerment Foundation, which initiated the first HIV/AIDS hotline, in Africa. That hotline still exists. And when you look at Ovie Brume Foundation has been in the forefront of addressing the needs of the poorest of the poor. They work most especially in public schools where, a lot of us went to public school, but we cannot even send our children to those public schools anymore. So there are a lot of challenges that are out there, and some of the people who are trained at that time come from across Anglophone Africa and Francophone Africa. But when you look at the attrition rate in the media, that's another challenge. So there has to be a media institutional response also. Besides journalism school, does not have a platform.
Akinlabi Jimoh, I think Professor Esson, who is in the UK, is on the ones to just chip in on that.
Okay, Prof. Can we unmute Prof quickly?
Unmute Oluyinka Esson.
Okay,
sir. My colleague will do that.
Okay. I think I've been unmuted now. Good evening. Okay. Good evening, ladies and gentlemen, and thank you very much for the opportunity that you've given me to contribute here. I already asked the question, which kind of links to this, that where is the science and reporting in Nigeria? And it's not because it's not there, but because it's been really badly relegated. That's one big problem. And also, when we think about the structures, Professor Fayoyin, thank you for turning the tables round. I sent you a question which you now sent back to me. The structures that we have in our education, even right from school, I don't think it quite supports the scientific reasoning, the critical reasoning that a people need to have in order to engage logically. That's number one. I think also we need in our schools of journalism, in our schools of communication, to pay a great deal of emphasis to science and health reporting, as we have, as the panelists have said. I agree with them completely that we don't do half enough. The emphasis still on, with regard to general reporting, the mainstream general reporting, there's no reason why we can't mainstream health and science as we do politics, but we tend to focus on politics. We don't do enough about the economy, And in fact, these days we tend not to think closely about the regulation of the gossip and the human interest kind of stories that that a lot of people then from conventions report in the social media spaces. So there's a problem there. And really, even the institutions, the media institutions themselves need to do a lot more. And I don't think it's new. I remember that you guys, and I may not know the story of Diran Onifade in particular, but certainly Moji Makanjuola's story I know very well, of how she needed to fund her own work, her own reporting. So it's about passion. It's not I'm saying this to explain why perhaps she was a little bit miffed at the fact that we think it's a lucrative bit to report. Let me add one more thing. It's good that we have the BBCs of this world and the ITVs doing the reports and having these bits done properly. But I also know that in some instances, institutions are not willing to jump into health reporting. I think I know only of one school, I may be wrong, but I know only of one school that has health reporting as a specialism in the university in the UK. Maybe I'm wrong. Maybe there are other ways, avenues that people get in, but that just goes to show that there's a problem. Thank you.
Thanks so much for your contribution. And I think we've exhausted. Let me check if we have any other question that more or less. I think there is someone that mentioned the fact that spokespersons of the leaders around the world are mostly eminent journalists. And can such aid or help their principals in terms of issuing information that more or less will help the public? You know, can such aid? But one key thing is, a lot depends on the type of aid that we are talking about. If you are not someone, anyway, let me just say, if you are not someone that's really understands health, or let me tell you a story in that regard. When you look at the time when we had AIDS cure problem in Nigeria, one of the key things we did at that time, you know, I used to be at the Guardian at that time. We have what we call the edits, a desk that rewrites stories. And when they received the story, at that time, we realized that people just send anything. Things that are not verified from anybody, things that health ministry does not have any inkling of what is going on. People come with different cures. And what we did was we take the head of that desk for a training on HIV/AIDS. He sat with people who are living with HIV/AIDS. He saw them. He interacted with them. By the time we got back to the newsroom, anyone that sent stories from outstation, they will say, desk, your story. Because a lot of the time, those people have propaganda machine who will create stories that, as an editor, that you have a page to fill, you just use it without verifying. So a lot of the time we have issues, you know, with that. Spokespersons, do they have training that has to do with health? Do they have training that has to do, even though that is really not important, it all depends on your interests. You don't need to be someone with science background to report, you know, an issue. The other thing is that platform is a different ball game. It's political. So it requires sandbags. The way a medical doctor will talk to on camera is different from the way a politician, you know, will talk on camera. And a politician is news. I don't know if Moji has anything to add to that.
Okay. Yes.
Which sells, politics or science?
Most often it's politics. Most often it's politics. But then
Okay.
again, the thing is, until of course we start treating health and indeed science as an investment for well-being, we are still joking, because there's health and science in everything, in everyday life. So we just need to push ahead and encourage more journalists to there with passion into reporting health and science. And that's it for now. And it's so nice to know that there are so many old veterans on this who have been listening in seriously. I know I saw my sister on it too. And I think it's important also that moving away not just with the with the reporters on the field, but also with the editorial board. We also must start engaging them, because the editorial board decides what story on what page or what segment of the news that health and science would come to. But because they themselves don't even see the importance, they readily want to sell their papers or sell their ratings than thinking seriously of health. And I think COVID-19 has taught us a big lesson here, that health and science, deserves to be given special attention. And I do hope that would have, I think University of Ilorin at some point last year, we're trying to talk to the University of Ilorin so that we can have journalists who are interested in health, and as well go for the kind of opportunities that Diran, myself, and Akin have had with the night fellowship and the rest of it. Thank you.
Yeah, I would try and we'll wrap up with two comments or questions. There's one from Dr. Louis Nkayeson, who said the issue of news reporting, of news being science-led, is more than the absence of the science minister, though. It is a case of the orientation to reporting, the orientation of the journalists to reporting, the orientation of the media organization to reporting. And those are key. So, which means, I hope I'm right, Dr. Esson, the media institutional engagement to be receptive, to reporting the underlying science of issues. The other comment is that someone said, Diran, you talk about the absence of the Ministry of Science and Technology in the scheme of things in Nigeria's response to COVID-19 pandemic, and how science has been generally relegated. Don't you think this has to do with our general attitude to science? What does the ministry have to offer in the first instance? And I will rephrase that. What do our science and research institutions have to offer in terms of the product of science? How much does our government invest in science, especially research, on annual basis? Are our universities well positioned to be actively involved in research activities? I think your responses will lead us to wrap up on this. So who is going to take the first shot? The question is, don't you think this has to do with our general attitude to science? What is our attitude to science as Nigerians? Mr. Onifade?
Okay, thank you very much. I think that question is also kind of related to what Dr. Esson was alluding to. I said initially that we have become, our news coverage is now led by the propaganda machine of the public sector and the private sector. If you remember, I said that. So that's how news works here. That's just it. So if that is the case, it is the news that they issue that will follow. So when science and technology is not involved, is not among those who issue the news. So you can expect, you know what to expect. But to say that our institutions, it's difficult to say. There is a general problem. I mean, you have so many universities, so many research institutions in Nigeria. At least they are doing something. That something that they are doing counts for something. If only we will have the attitude of beaming some searchlight on what they are doing. And, having visited a lot of those research institutions, I don't want to believe that not much is going on. There's a cluster around Zaria. There's a whole lot they are doing, particularly in the area of agriculture. Agricultural science, crop science, genetic modification research and things like that. Those things are going on. If you go to Firo, Oshodi, in Lagos, you will see that they are doing something. In Umudike, root crops, they are doing something. In Ilefe, for instance, I know of a professor that was doing something about these are local vegetables. Because when people say veggies now, they're looking at cabbage and lettuce and all these things. What has happened to all those for all these things? What is happening? These things are going into extinction. But there are people who are working on those things. We just don't know that they are not working. So let's not say that our scientists are not working. They are working. They are just doing things that we are not interested in. We have to create interest in what they are doing and develop them from that sense. I am not saying all of them are working, but at least you can find that between 20 to 30% efficiency in the system, 20 to 30% productivity in the system. That in itself is something worth reporting, and you can find fantastic news even among all those things. They are working. Some of them are working. Yes, majority of them are just working to become professor. In fact, this is the situation, because their research motivation is just to write papers, and they get published, they become professor. Once they become professor, they lose interest. This is the point. That they are working.
Thank you. Yeah, thank you so much. I think you've covered virtually all the questions.
Yes, I just want I also want to mention, hello, Aki. I also want to jump in that we have the Nigerian Medical Research Center, NIMA, in Lagos, Yaba, Lagos. And you need to visit there to see a lot of work that has been done. Some are on the shelves. Some have given us international support.
Recognition.
These are areas where they are not properly funded. You see, funding for research in Nigeria is so limiting. Funding for health is something else. So funding for research, medical research, is so small. And these are the areas where science and health reporters can also amplify and know that we need them. With COVID-19, these research centers have become an imperative to finding peculiarities to our own needs in our country. And I think that this platform, I think we should do something about it. Nigerian journalists, Nigerian media can do something about this.
Please, information, please. If you did not register for this webinar, please drop your email address so that we can share the recordings and the presentation with all of you. Please put down your contact details, your email address, so that we can share material with you immediately after this, especially those of us who are journalists. If you are not a journalist also, these are material that will help you. And the one key thing that has helped, you know, in HIV and other pandemics is information that is from hand to hand. Let's say, okay, if it's mouth to mouth, hand to hand is dangerous for COVID-19. Information that is from person to person at a distance will help a lot. So please, we have someone on the platform, Ayebo Sado. You've been unmuted. Can you share your perspective briefly, and then we can put this, round this up. Thank you. Ayebo.
Thank you very much. Thank you very much, sir, for giving me audience. I am a pediatrician by profession.
Oh.
I am from University of Benin Teaching Hospital.
Wow.
I'm very happy to have attended the webinar, which seems to have been meant for the media. So I learned quite a lot here. But I just want to speak to the issue of asking the expert, as Mrs. Makanjuola talked about. The media has to be careful when they are asking the expert. Not everybody who answers by the name doctor is a medical doctor. So we're talking about COVID-19, and a media house goes to ask an anatomist to comment on a clinical illness. It's like asking me as a pediatrician to talk about a building that has collapsed. What do I as a doctor know about buildings that collapse or about their structures? So I think they should take effort to ask, to know who they are actually asking to make comments on things, because this is important. The other thing I want to speak to is the issue of some of the misinformation and myths already going around. They're already talking about the COVID vaccine for the COVID-19, which is not available. And yet, because of the way the media has reported it, social media and all kinds of things, it's affecting the routine immunization which we give to the children. And we all know that immunization is very important for children. So I'd like the media to always look at the potential effect of not be information they are giving out. It may be something that makes somebody to take a decision on what is life and death. So the media should know that even though they're just talking news, that news can be the difference between life and death for some individuals. So on the whole, I want to thank the organizers of this webinar. It's been a very useful event. And I also want to thank the speakers and the moderator for all the information that they have put out. Thank you very much.
Thank you so much, Ma. Please, can you please remember to put down your email addresses, and so that in case we found ourselves in Edo, actually DEVCOMS is coming to Edo by July to work on issues related to family planning. And perhaps our journalists there, our colleagues there may contact you once in a while on issues with family planning, pediatrics, there are interlinkages between mother and child to a large extent. Thank you
very much. I'd also like to thank the pediatrician, ISMPH, where I work. We're also working on severe acute malnutrition, and I'm sure that would be very interesting to you. So we would also please let's have all your details so that we can we can work with you and use this platform for pediatricians to speak out, that while the country is talking, speaking to palliatives, because that's what we hear now, they should also remember the voiceless Nigerian children who are malnourished or severely malnourished, and also ensuring that RUTF, ready to use therapeutic, is not out of stock, but we should start thinking of made in Nigeria RUTF. so that we can always be here. We can always have it available for children with SAM. Thank you very much for your comments.
Thank you very much, Ma.
Thanks so much. Let's just have a brief 30 seconds to 45 seconds from our panelists. Your last word. Just for this webinar.
Yes, I wanted
you
to clarify.
Yes, okay. I think it's been a great opportunity to have this interaction. But I think it has to continue. There are still many unanswered questions. There are still many more questions that we need to look at. The issue is evolving. We just need to be able to respond to it in a progressive way. So I think this kind of partnership is critical from the university system, the media professionals, the NGO community. We need to think through a program to help us do this a little bit better. Thank you very much.
Okay.
Thank you very much. I'd like to say that it has been a wonderful experience, and I think station, like Prof said, should continue. And I think what's important for us is the need. Please, we ensure to share this conversation with media houses, and which is my concern, and also share with members of the public. But I think that we should have a system where we can put to action some of the issues that have been spoken to. And I thank you very much for inviting me to be part of this development.
Come back quickly. Oh.
Pray for me, oh. Pray for me.
All right, so I think, generally speaking, yes, we have issues with science reporting in Nigeria, but Nigeria now has a greater issue with its journalism. Mm-hmm. So we do not just have a science journalism problem, now we have a journalism problem in this country. So we cannot isolate science journalism.
Science journalism, yeah.
We need to work on what journalism has become since 1999, when democracy took over our own understanding of how to support this democracy needs to be reconsidered. So, and it's not something that media investors alone will do. Researchers will do part of the problem, part of the work, because ideas need to be put on the table as to the way forward. Funders need to do a whole lot. I mean, for instance, we will say our scientists are not working. Research cannot function in isolation of funding. Who is funding research in this country? Of all the money that has been donated for COVID, the one that is going to palliative is going for palliative. The one that is going to this is going for this. How much has been earmarked for research? And if research is not happening, research will not be covered. So those are two things. Research needs to be funded, and then Nigeria now needs to know that it has a journalism problem. It's Nigeria's problem. How Nigeria wants to resolve that is no longer in the hands of the media, is in everybody's hand. Thank you very much to all the organizers and to my colleagues. Nice to see you people again. I hope to see you some other time if these things happen again. Thank you.
Thank you, our panelists. I don't know if Mrs. Awobemi, the Oga Patapata of Ovie Brume Foundation, would like to say something briefly. Mrs. Diola Awobemi.
Okay, thank you, Mr. Jimoh. God bless you. Thank you. It's been a very enriching conversation. I'd like to thank Professor Fayoyin side. It's been a pleasure listening to you. I've heard about you, but today I'm hearing you speak for the first time, and I'm taking a lot away from this session. Mr. Onifade, amazing. Thank you so much. One of the things that I was in a webinar last week, and one of the things that I also said was about the private sector and government, and you were able to talk about that also, because I believe that the private sector has been insensitive somewhat in terms of giving palliatives to the government, and forgetting to work with the non-profit sector and organizing to take care of other needs, particularly for our children. So I really thank you for bringing that to bear this afternoon. Auntie Moji, God bless you, ma. Thank you so much. I've also listened to you, and we're very happy to hear from you today. God bless you for all the things that you do, for putting all the comments forward today. I believe that everybody has also benefited immensely from your contribution, and I know that going further, I really like your suggestion, man, that this should not end here, and Professor Fayoyin, we will take it further. Working with Mr. Jimoh, we will definitely take this further, and I want to assure you that the reports, the recordings will get to everyone, so do be rest assured. On behalf of the board and management of the Ovie Brume Foundation, I'd like to thank you all speakers. God bless you. Thank you for partnering with us on this. For everyone here today who has attended, we're very grateful for your support. And for those who could not attend due to one reason or the other, be rest assured that you will also get the reports of these, the highlights and the recordings. Thank you, Mr. Jimoh, for making this possible. God bless you.
Yeah, thank you, everyone. Please drop your email address. And Mr. Onifade, thank you. Let me inform those of us who are journalists. There's a new platform that has come up. It's called the Africasti.com.ng, Africa Science, Technology, and Innovation News. It's a platform that is being initiated by Onifade alongside a number of other organizations where we can push our science-related stories.
Mr. Jimoh, can you put the link on the chat box, please? Mr. Jimoh.
Okay.
Can you kindly put the link to the Africasti on the chat in the chat box, please?
Okay, I will do that. Okay. Okay, I would, organizations, Youth Empowerment Foundation, Ovie Brume Foundation, and Development Communications Network, the International Society for Media and Public Health has been wonderful. Africasti has been wonderful. There are a lot of things we need to do. Thank you for a friendship of a lifetime. We all have something to contribute, because if we don't do it, there's a saying in Yoruba, I don't want to say it in the speaking vernacular, but it says that if you can translate to Yoruba, let me speak in English, that if your neighbor is eating bad frog or bad thing, when the trouble comes at night, you yourself will not be able to sleep. So if we are not addressing issues that has to do with COVID-19 well enough, because there are a lot of misinformation out there, and we belong to a lot of platforms. People post anything, sent as received, and when it's sent as received and nobody counter that information, it becomes the truth. So when it becomes the truth, it becomes what everybody takes along, even the person in your household, your housemaid, your children, your friends, your husband, your wife. I won't say concubine because it's not allowed. But the main thing is it affects virtually all of us. We should be purveyors of the right information at any point in time. Information may be cheap, but what it brings may be more expensive than what we can address. Government has a role to play. Media organizations has a role to play. Researchers, research institutions, we need to know what they are doing. We need to know what are the findings. And unless we all work together, we'll be in the same situation, I won't say for the rest of our lives, but for a very long time. Thank you so much. See you at the next webinar. You're welcome.